My name is Sakshi. I have two questions, very short.
Sakshi means witness consciousness.
The first question is, what is the difference between samsara in Buddhism and in Vedanta? And the second question is, in modern medicine, there are various anti-aging technologies and stem cell transplantation being used for good and for diseases. So I was wondering how that has an effect on the concept of Brahman, the witnessing consciousness, and how does that relate with also the concept of Vairagya?
So those are deep questions. Concept of samsara in Buddhism and Hinduism, the big picture is that it's the same conception. In the general, there are varieties of schools within Hinduism, and in fact within Buddhism also. But there was a common view of the human situation in these Indian philosophies. In all schools of Hinduism, in all schools of Buddhism and Jainism and also Sikhism, it's a sort of a common worldview. The details are tremendously different. The common worldview was we are sentient beings, we are in suffering, we are caught in this cycle of birth and death, and spirituality is a solution. That's common to all of them. But what is it exactly that constitutes our bondage, and what is the meaning of liberation from suffering, and how do you get it? These are different in different approaches. And all of them contain very valuable insights. So I'll just leave it at that. Samsara is the cycle of birth and death. It is inherently sorrowful, and it is propelled by, why does it happen? It's propelled by karma. Our past karma is generating this life. And as we deal with this life, we are generating new karma that will generate future lives. And it seems to be a ceaseless cycle which you cannot get out of. But spirituality shows a way to free ourselves from this limitation. Buddhism will put it this way, then again oversimplifying. It is our grasping to the sense of self, which is body-mind, a limited self. I am an individual separate from everybody else, and that individual, what is that individual? It is somehow this body-mind. And that's what's creating this problem. This body-mind is inherently limited and unfulfilled, and ever seeking to survive, to dominate over others, to gather all kinds of resources for one's own, the happiness of only I, me, mine. All of these projects are doomed to failure. This body-mind will not survive, this body especially, will not survive. And no matter how much resources you pour into this body, it will not give you lasting fulfillment, so on. Hinduism also has various answers to this, why the samsara is going on. Basically karma and multiple lifetimes and this limited nature, no fulfillment, lasting fulfillment in worldly ways. And there are spiritual solutions to this. And the second question you asked was, modern scientific advances, what is its relation to Brahman? Let me connect it to the first question you asked, samsara. Instead of asking what's the relationship of stem cell research and fighting diseases through science to Brahman, I'll answer what's its relation to samsara from Vedanta, let's say from Vedanta. From Buddhism also. Very beautiful insight, very clear from Buddha. Vivekananda said he was the sanest man who ever lived. No cobwebs in that brain. What spirituality can do and what spirituality cannot do. So there's something that the world throws at us. Old age, disease, death, the three kinds of sorrows. Natural sorrows, earthquake, whether big earthquake or baby earthquake. But nature is throwing at us. Behavior of others, diseases caused in the body and the mind. So all of this nature throws at us. Buddha compares it to an arrow which hits you. We are hit by that arrow. Then there is a second arrow which hits us. What is that arrow? That's our reaction to all this. How we react to it. You notice it's the same analysis as the causality of sorrow. First is what the world throws at us. That's the first arrow. Second arrow is how we react in the mind. We generally react with, ain't it so bad? It's so awful. So our reaction to the sorrows that the world throws at us generates unhappiness. And the Buddha's insight here was, most of our unhappiness is in our reaction. Now one might dispute this. No, our reaction is natural. The world is really the cause of our suffering. But then in that case, just look, the same suffering, the same old age, two different people deal with it differently. The same disease, two different patients. Doctors, the many doctors here, you will know that some get terribly upset at minor problems. Some deal with life-threatening diseases with dignity and calmness. That means, who is suffering more? Normally you would think the life-threatening disease is the cause of more suffering. And the minor illness should not cause so much suffering. But actually, if you look at the patient, the person with the life-threatening illness who is calm is suffering less psychologically. So our reaction to that second arrow is what causes real suffering. And Buddha said what spirituality can do, but Buddha, what he taught, his teaching, but then that's true of all kinds of spiritual teachings. It deals with that second arrow. Our reaction to the world, to the body, and all of this is changed. And so we do not suffer. Whether through devotion, love of God, whether through selflessness, my problems, even if they are big problems, are of no importance. What's important is the suffering of others, and I'll be engaged in trying to help others. Those who are selfless, they suffer less. They suffer less because they don't give importance to their own suffering. Those who are self-absorbed, they suffer a lot. Every little thing is a catastrophic problem for them. And psychologists say there is a term called catastrophizing. Then, this is the cause of suffering, the second arrow. And if spirituality deals with that second arrow. Now what you said is the first arrow, dealing with the first arrow. Science deals with the first arrow. So the world throws illness at me. Now science will give me medicines and therapies and all, which will try to reduce or mitigate the effects of that illness. So what should we do? Use both science and spirituality. It's spirituality which will really help us. But to the extent that you can reduce the effect of the first arrow, why not? Why not? Science and therapies and healthy living, all of that will reduce the effect of the first arrow. Careful living, disciplined life will reduce the effect of the first arrow. So, a combination of these two. I remember I went to a hospital, there was a seminar on mindfulness in a hospital in Arizona. And they asked me to speak about it. And I said, look, the two arrows, and I'm glad that in the hospital you're doing this. Now this hospital is doing both. Dealing with the first arrow, which it's supposed to do, actually reduce the physical pain. But also the second arrow, our reaction to that pain. So mindfulness is part of that spiritual therapy. And that's the wise way of looking at life. If you have physical problems, even mental problems, take the help of doctors. Take the help of therapies. And also, more important, have a spiritual life. Carl Jung, he said, I'm quoting him verbatim now, is in most cases of mental illness, in middle age and after, I have seen it can be directly traced to a divorce from the patient's, between the patient and the patient's church. That you have somehow stepped away from spiritual life. And then you are unable to combat the sufferings that life is throwing at you. He said there's a deep connection between those who are religious, who have connection to some kind of religious tradition, seriously, and resilience in facing suffering. Okay.